I'm Judith Gonzalez. I'm an RDA here at Spring Valley Dental in Dallas, and we are doing our quarterly radiation test, the QA/QC, which would be the quality assurance, quality control. That is according to the Texas Department of State Health Services. The law is 289.232, Section I-16, and this is along with the evaluation performance evaluation that has to be done by a certified company. So this is in addition to that. You have to do this on your own at your office quarterly, so every 3 months, just like perio maintenance. So we got these things called step wedges. We got a big one like this and a small one that we use in the actual room for the regular x-rays that we take for bite wings and stuff. But this big one, we got it from a company called Margraf, and they simply told us to glue it to tape it to the actual sensor. When we did that, it didn't work. So it worked in the room with the sensor that we take our bite wings and our PAs with, but it did not work on here. We taped it onto here. So this is what we did. We jerry-rigged it. So we just pretty much taped it on here the way where the patient would normally have their head, and this is how we were able to get a successful taking of it. So if anyone knows how to do this correctly and on here, like other than having a jerry rig it like this, please comment on the video. But other than that, this is what worked for us. So I am gonna go ahead and take a test. I have it on 63, which is what we normally use for the kiddos. Yeah, they're not there. And that is what you should get. So you want to, on here, I already have a file saved, like a patient under QA/QC. So that's what you would want to put in, as in first name and last name. And you want to add a note. So you pretty much want to do this in 3 different sections. You would want to do one for the radiation you would do for a child, the one you would do for the average adult, and then what you would do for someone that is a bigger person or with a really dense bone. So here I'm going to put child, and we did 63 kVp, 10 MA. And I'm going to go ahead and save this, since it already has it saved as a SEF. So now that it's saved, we're good to go, and we're pretty much gonna do this 2 more times. One for a regular adult, and then one for with a higher radiation for an adult that has dense bone.